What was interesting for health and social care as part of this Queen's speech essentially came in the form of the Care Bill, which proposes dramatic reform and simplification of social care in England and the way that long-term social care is funded. The bill essentially proposes a cap of £72,000 on the level at which any individual would have to contribute and pay for before they're eligible for government assistance. And it also raises the means testing threshold from £23,000 to £110,000. It's worth saying that these recommendations build on the Dilnot Commission, and the caps are higher than what he made, what he suggested in his final report. But it's worth mentioning that the bill is a real achievement in itself, because social care funding reform has been the objective of several successive governments, all of which have failed to reach an acceptable political consensus on the matter. Other things which were interesting was the absence of public health intervention measures on the minimum pricing of alcohol and also the plain packaging of cigarettes, which the government has said it was generally supportive of but has failed to include in this programme of activity. It's worth noting that this bill also introduces Ofsted-style ratings for hospitals and social care homes, and this comes in the wake of the Francis report and the mid-staff scandal, which recently was reported on. Finally, the other really interesting area for the NHS comes in the form of the immigration bill, and this essentially puts forward proposals to limit migrant access to NHS care free at the point of return. So individuals, foreign nationals coming to the UK will not be able to access NHS care without having made contributions first.